Module Overview. This first module introduces you to the philosophical foundations, guiding principles, and practical applications of ethics in healthcare settings. It sets the ethical tone for the entire course and lays the groundwork for understanding how ethics informs confidentiality, data use, patient treatment, and professional conduct. Ethics in healthcare is not merely about having good intentions or doing no harm. It is a structured system of principles and decision-making models that guide professionals in delivering care, handling sensitive information, and navigating complex clinical situations. Healthcare ethics provides a moral compass for balancing individual rights, institutional needs, cultural expectations, and legal obligations. 1. Definition and scope of ethics in healthcare. Ethics refers to a system of moral principles that govern behavior. In healthcare, it governs decisions regarding life, death, dignity, autonomy, access to care, confidentiality, and justice. It influences how professionals approach truth-telling, consent, end-of-life care, resource allocation, and data privacy. There are multiple branches of ethics relevant to healthcare. Clinical ethics involves bedside decisions such as treatment refusal, patient autonomy, and consent. Organizational ethics involves policymaking, resource allocation, and leadership integrity. Research ethics covers informed consent, use of human subjects, and risk-benefit assessments. Digital ethics addresses the use of electronic health records, AI diagnostics, and data algorithms. 2. The 4 pillars of medical ethics. These universally recognized principles act as the ethical foundation of modern healthcare. A. Autonomy. The patient's right to make decisions about their own healthcare without coercion. Professionals must respect the patient's values, preferences, and informed choices, even when they disagree. Beneficence. The duty to act in the best interest of the patient. Every clinical decision should aim to promote health and prevent harm. C. Non-maleficence. First, do no harm. This principle urges caution in diagnosis, treatment, and data use to avoid unintended consequences. D. Justice, fair, and equitable access to care, resources, and attention. This principle demands that all patients be treated equally regardless of race, gender, socioeconomic status, or disability. 3. Ethics versus morality versus law. Ethics, professional standards that guide good practice, e.g., confidentiality, integrity. Morals, personal beliefs about right and wrong, e.g., religious or cultural norms. Law, legal rules enforceable by the state, e.g., GDPR, medical licensure requirements. All 3 intersect in healthcare, but they don't always align. Ethical dilemmas arise when moral or legal obligations conflict, e.g., treating an unconscious Jehovah's Witness who would refuse a blood transfusion. 4. Common ethical dilemmas in healthcare. Should a doctor respect a patient's refusal of a life-saving treatment? Should a nurse breach confidentiality to report a domestic abuse case? Is it ethical to use patient data in research without explicit consent? How should healthcare providers prioritize patients in a resource-limited setting? 5. Ethical decision-making frameworks. To solve dilemmas, professionals use tools such as principlism, balancing the 4 core principles: autonomy, beneficence, non-maleficence, justice. Utilitarianism, choosing the option that benefits the greatest number. Deontology, following duty-bound actions regardless of outcomes. Virtue, ethics, emphasizing character traits like compassion, honesty, and integrity. 6. Code of ethics in practice. Every professional body has an ethical code. Examples include NMC Code, UK Nursing and Midwifery Council, GMC Guidelines, General Medical Council, HCPC Code, Health and Care Professions Council. These codes emphasize trustworthiness, respect for dignity, cultural sensitivity, and professional conduct, especially around privacy and data handling. Module accreditation notes. This module aligns with CPD Certification Service Ethics Training Benchmarks. GDPR Recital 39, Fairness and Transparency in Data Handling. NHS and WHO Ethics Frameworks on Patient Rights, Privacy, and Data Integrity. Health and Social Care Act, UK Ethical Standards in Care Delivery.